All right, good afternoon, everybody. Happy Thursday. Here with Josh, Deirdre, and Paul. Wanted just to give you our update. You remember a couple days ago we had Dr. Koh. As we see some flare-ups in our region when it regards COVID, Dr. Koh told us about some of the therapies that are in the offing that give us a bridge to that vaccine. And today we're going to focus a little more about some of the things municipalities can do to contain the spread of the virus. What we can do is an economic bridge to the vaccine as well to help out small business and individuals. Here are the daily summary. I think a couple of things. You see another almost 16,000 tests. That's well over 100,000. Positivity rate of 1.3%. As you know, it's bouncing around a little bit. Say a month ago we were at 1%. Last couple of days we've been over 2%. Now we're at 1.3. I think we're at about 1.6% positivity over the last 7 days. What does that mean? That means, for example, Massachusetts is at 4% positivity. Rhode Island is at 7% positivity. These are all elevated numbers. New York gets skewed a little bit because it's such a big state, so if you're in parts of Brooklyn and Queens, you can have 7 or 8 or 9% positivity. If you're in the Adirondacks, it's a lot less. But it gives you an idea of what's going on a regional basis. Hospitalizations +3, now up to 191. That's a number that all the governors I've been talking to are beginning to pay a little bit more attention to again. Make sure we have the capacity there going forward. And finally, another 3 fatalities. This is a chart we're going to do on a more regular basis for you, at least every Thursday. These are sort of the alert levels that you see. We had, I'd say, 4 in the red alert, 15 or more per 100,000 when we showed you this map about a week ago. Today it's at, I think it's 11, Max has told me. You see those are in the red. I see a couple of things when I look at this map. I don't like the fact that Danbury is still on this as a red alert because we've been bringing in the cavalry there now for 3 or 4 weeks. That said, we brought down the infection level from 7 to 4%, but it's worth remembering that when COVID hits, it goes up, the infection rate, like a hockey stick, and it goes down a lot more gradually. I think you can see also that in southeast Connecticut, where we've had a lot of other new additions to the red alert level, they are in a region. We had seen from Danbury that we could contain this on a just municipal basis, but we also know that it also can have some regional spread, another thing that we're following very carefully. So I'm sure this is a real eye exam for you. I can't even see the names, but what I will tell you is we'll get this out to you in a clearer way on our website, be able to see where your town is on the red, yellow, and orange alert. And let me tell you what that means on the next chart. This is something that Deirdre and Josh have worked together really well. On the yellow, which is 5 to 9 cases, let's say we're at about 8 cases per 100,000 here as a state overall. I think that is sort of a steady as you go, maintain your vigilance. Orange, which is 10 to 14 cases per 100,000. There we have a few more. There we're dealing not just with the local health departments, but Deirdre and her team at Public Health will be reaching out to the local officials. We're doing this already, but ramping it up going forward. Let's say limit the size of your groups. Be more careful because orange could lead the red, as you've seen over the last couple of weeks. Pre-K through 12 schools, be careful there. Continue to try and maximize your spacing, mask wearing, ventilation. We're going to prioritize that. Hopefully you can keep the in-classroom learning going, but that's the extra attention we need. I should tell you that we've gone from about 33 to 40% of our K through 8 schools are now open on a full-time basis. So that's just a reminder what's going on broadly in the state in terms of allowing kids to get back to school, mainly moving from hybrid to full-time. Finally, in the red alert section, it's just worth seeing. There you are, well over 15 cases. We've got a number of communities there. These are our recommendations. These are not mandates, but our recommendations are certainly to, for example, postpone indoor activities, including some of the sports that would be indoors. Work in collaboration with your local health department when it comes to schools. Maybe time to start thinking about more remote learning in a situation like that. And as we talked about the other day, if you're in that red alert category, you could see those on the map. We're giving the local mayors discretion to not move to phase 3, to stay at phase 2 or revert back to phase 2. So not 75% restaurants, but 50% restaurants. That's at local discretion. Please notify us in the next 3 or 4 days where you plan to be in that mix. But I think the red alert level, these are ways we're trying to highlight some of the risks you've got there. And Deidre will be in a strong position to tell you, what our thinking was behind these as needed. I did want to say that these are things the town can do to try and mitigate the spread, to try and contain the spread as we see flare-ups around the state and even bigger around the entire region. We're not like Wisconsin with a 22% infection rate, but we do have areas that have 5, 6, 7% infection rates, and there we want to try and contain that as best we can. In the meantime, we ought to be thinking as well about what we can do for our small business and individuals, because while we've got 99% of our economy is open, as you know, the service sector has been slower to be able to get back on their feet. There are a number of groups that aren't going as all. We've got theaters, not-for-profits, and others. And what can we do to help them in the meantime? Obviously, we had hoped that we'd see the federal government step up by now. They haven't. So we have a couple of strategies in place that we'll be able to roll out in more detail. You've heard from the Department of Housing. We upped the amount of rental assistance from $20 to $40 million. There we're negotiating that between landlord and tenant to allow you to stay in your home, to stay in your apartment longer without risk of eviction, no eviction. We thought long and hard about the not-for-profits who have been doing heroic work for us throughout this entire pandemic, providing what support we can. Melissa McCaw over at OPM, she's dispersed a lot of the $120 million out of our COVID relief money to go to those not-for-profits in social services and housing and addiction, and ways that we can provide you the support you need to make up for some of the COVID-related expenses that have hit you. And that money is going out the door now. Most of it has been dispersed. Thirdly, David Lamont and Glendolyn over at DECD, we did well with the Paycheck Protection Program, keeping people in place, keeping their jobs going. But that money has run out. We had a bridge loan program for a while. That burnt up pretty fast. So David is going to be rolling out next week, the next iteration of a grant program, not a loan program. Keep it simple. This is going to be $50 million. That's going to be focused on small businesses, those with 1 to 20 employees, those that have taken a real hit in terms of, COVID revenues shortfall. Half of that going to distressed municipalities, making sure those smallest companies, maybe not as easy for them to access all the PPP. We are making that available. It's going to be available as a grant. We're going to get that out the door over the course of the next 60 days and make that available to all of our small businesses we can within those categories. More details than that to come. And that's also going to be available not just for small businesses, but also not-for-profits. We'll be doing something bigger for the event venues that have been put off, but other not-for-profits, in addition to the COVID relief money we've got going for you, in addition, some of these grant monies will be there. And finally, that takes me back to the program I'm most enthusiastic about, to be blunt, and that's called Shared Work. We've talked about that in the past. I just want to remind you it's available. It's available now, and take credit for it. Take advantage of it. And we have a lot of resources. Nobody will be turned away that is so deserving. So if you're in a small business and you're just trying to think right now, boy, I'd like to be able to keep Bob, Mary, and Jose on, but I can't afford all three of them. I'm going to have to lay two of them off. That's not the choice you have to make anymore. If you can only afford to keep them on board for 50% of their time, keep them on board for 50%. Shared work will pay for the other 50%. So it's, as opposed to unemployment insurance, to me this is like employment insurance. And I just think it's invaluable. It's invaluable for small businesses and larger businesses. It's available for not-for-profits. Again, not-for-profits, take advantage of this. It's a way to keep people employed. You can't afford their full salary. You can afford part of their salary. So as our economy slowly gets back in the gear, you'll have people already in place, working part-time, ready to go full-time. And you can access this, sharedworkct.com, sharedworkct.com. Let's see the video, Max.
It happens to every business. A bump in the road. Maybe demand for your product or services goes down. The market goes in the tank. You don't want to lay off staff. They're like family. But what else can you do? The answer? The Connecticut Department of Labor's Shared Work Program. The Shared Work Program saves employers money and employees jobs. Here's how it works. Instead of cutting jobs, you cut hours. Then employees can collect partial unemployment benefits for the hours they've lost. Say an employee's hours are cut temporarily by 50%. In addition to a partial paycheck, the worker will get 50% of his or her regular weekly unemployment benefit. In other words, employers save payroll and hang on to their skilled workforce, while employees keep their jobs and collect unemployment for the hours lost. Don't think of the Shared Work Program as unemployment insurance. Rather, it's employment insurance, a safety net. This is a program that keeps workers employed. This is a program that shows employees that you care. The Shared Work Program protects your business during slow times. Connecticut's Shared Work Program. It saves money. It saves jobs. Plain and simple, it's working downturns into upturns.
Exactly. Making lemonade out of lemons. And this is what the Shared Work Program does. I got to say, special thanks to the folks from Franklin Products and Torrington. David and I were there today. They made seat cushions for airlines. And let's face it, airlines are not flying as much these days. That business was really slowing up. They were forced to start laying off people, and they've really been entrepreneurial. A, they're taking advantage of the Shared Work Program, and B, they're starting to make masks and gowns right here in anticipation of what we may need in terms of COVID. And finally, just a reminder that all these programs to mitigate the effects, slow the spread in our municipalities, help our businesses get back on their feet. The therapies you heard Dr. Coe talk about on Tuesday, this is all part of our bridge to get to that vaccine. I can't tell you when it's going to be here. It's not going to be here as soon as some of the political promises, but it should be available by sometime in the first quarter, half of next year. And Deirdre Gifford has put together the advisory group. We've announced who those people are. She's going to get the preliminary draft of our recommendations out to CDC. I think it's tomorrow is their requirement. We'll be looking at best practices from all the other states going forward. The vaccination will happen in a couple of phases. We're thinking about the critical workforce, otherwise known as the essential workers. We want to make sure they're vaccinated, feel safe being able to be at work. And those high-risk individuals, those who are most vulnerable. Those will be some of the priorities we have. Slow down. I know that we don't have a vaccine yet, and that still is going to be 2, 3, 4 months away, depending on the progress they have with the clinical trials. But we are beginning to make some progress right now. And Deirdre will be happy to tell a little more about our thoughts in the advisory group. And the advisory group is also there to opine not just on the vaccine itself, but how we can convince people that they can take this vaccine safely. With that, Max, any questions?
Channel 3 Eyewitness News. Good afternoon. First question, where do you stand on the travel advisory now that there are 36 states on the list and New Jersey and Massachusetts are getting close to the benchmark and Connecticut has been bouncing around as well with numbers? Are there any specific changes being considered?
I think so. It'd be a little ironic if we were on our own quarantine list. It does make sense. Look, we're talking about 3/4 of the states out there. I'm thinking I got to work with Deirdre and Josh on this. That perhaps at some point we just say you get tested before you fly into Connecticut. You don't get you quarantine when you come here. I think maybe we start treating all these states as one. It's getting a little complicated. Who's in and who's out week in and week out.
And what are you hoping to discuss at tonight's COVID vaccine advisory group meeting?
Did you hear that, Deirdre? The COVID vaccine advisory meeting date?
Yes. Good afternoon, everyone. So tonight's meeting will be an introduction for the most part. We're going to let the advisory group members know some of the framework that the governor was just discussing. We'll discuss at a high level the contents of our initial draft plan that's going to CDC tomorrow, get their feedback or thoughts on that so that they can be incorporated into subsequent iterations of the plan, and then just talk about overall goals and the structure for the subcommittees as well.
Thank you.
News 8. NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. I know earlier, we had talked about how you wanted to focus some more on certain communities, been talking about, rolling back to phase 2. I guess just first off, have you heard from some communities that do want to do that? Because we've heard from a couple that have said that they don't think the idea is workable.
Yeah, Matt. For the group that was from the category that we first introduced Tuesday or last week, I think I'm told that Wyndham is interested in rolling back. I'm told that Norwich and New London may want to pause before they roll back to phase 2. So they're exercising their discretion.
And when you announced that, I guess it was a few days ago now, or almost a week ago, we had talked about how you had initially wanted things to be more on a statewide basis, but now where we have these 11 towns that are in this red alert, it seems like you're really trying to focus in on certain towns and certain communities. Can you kind of explain a little bit more about your shift in thinking, and also kind of what is the message kind of directly to the people and the leaders in those communities right now?
Yeah, I would say 6 months ago when we said let's work on a statewide basis, I didn't want some communities saying my bars can be open and others not. We wanted to have a cap in terms of permissiveness. We wanted to be fairly strict broadly across the board. Now as we're opening up, we're on the inverse of that calculation. So we're allowing municipalities to open up, based upon the statewide metrics. But if those municipalities don't feel comfortable, want to be a little more aggressive in terms of what they think could potentially mitigate the spread, we allow them to tamp down. We're never allowing some to open up widely and others not, but we are allowing others to be more strict if they want to be.
And what about the people, I guess, who live in some of these communities? Because a lot of these ideas seem like a personal plea for people to change their behaviors.
It is. I mean, that's why we have an alert. That's why Deirdre sends a text alert out to people in these communities that are yellow or, in particular, red. We want to highlight that your behavior makes a big difference. More than going from 50 to 75% in some facility or another, it's your behavior that makes the big difference. And that's what we're trying to emphasize.
Okay, thank you.
WTIC 1080 News. Fox 61.
Yeah, Governor, on the shared work program, the inevitable question that will come up is what about independent contractors, individual people who hang out a shingle as a plumber, an electrician, even a lawyer? Is there a way that they will be able to participate in the shared work CT program? Maybe their work has been cut back by 50%. They're not anybody's employee. They don't have any employees. What can they do?
I'm told that the sole proprietors, those PUA, are all eligible to get their unemployment. So these are for folks that have, a company, and so they'd be in a different category.
And on the subject of vaccines, with the Democrats chastising President Trump for perhaps unwisely, unsafely rushing a vaccine to market, the Republicans countering by charging the Democrats with undermining public confidence in a vaccine. But that is the backdrop. How do you convince people in Connecticut to take advantage of it, to participate when a vaccine is available? Because no vaccine is effective unless people participate.
I'm going to start and then pass this right to Deirdre. But it does seem to me that I like the fact that the pharmaceutical companies themselves are stepping up. And they're the ones doing the clinical trials. They're the ones that say, hey, there have been some infections or adverse reactions in this category or that category. Let's take a pause. They're the ones earning confidence. I'd like to think that the CDC and the FDA are taking the lead and taking this more seriously, whatever the political rhetoric. But at the end of the day, I think I'll listen to Reg and Deirdre, because I think their commission is going to give me the confidence I need to take the vaccine.
So I would add to your comments, Governor, there are, in fact, 3 federal committees right now that are looking at this vaccine process. And these are long-standing, far predate the current administration. These are long-standing federal advisory bodies with really a sterling worldwide reputation in the United States vaccine approval process. There's a body at the CDC called the Advisory Committee on Immunization Practices. There's a National Academy of Medicine advisory body, and then there's an FDA advisory body. And all of them will be scrutinizing the process by which this vaccine is approved and helping us make recommendations in the difficult strategy for prioritizing populations in the initial phases when there's not a huge ample supply of vaccine. So I, like the governor, and you may know I'm a former career federal official myself. I have a lot of confidence in the career federal officials at the FDA and the CDC. They take this seriously and have committed their careers and their reputations to the safety of these vaccines. So like the governor, when we look at these processes and see that they've adhered to the typical, very rigorous American process for vaccine approval, I'll get in line, and when it's my turn, I'll get the vaccine.
All right. Thank you.
The Associated Press.
Thank you. Good afternoon, everyone. I have a math question, and it's arguably not my strong suit. Can you please explain how a resident of a small community, like, say, a Canterbury, how do they interpret these case numbers by 100,000? I'm sorry, I don't really get how do they figure out how serious that is for them?
Go ahead, Josh. You're a math whiz.
It's simply a way just to adjust it for the size of the population in a town, so that people are on more of a normalized basis. And it's important for people, particularly who are in small towns or medium-sized towns, where, if we were just looking at the number of cases, they may not show up, but it could be a significant percentage, of what's going on in that town. And that's why this color-coded map hopefully helps represent that in a way that's easier to access and can show, for example, how we're seeing a bunch of towns clustered up in southeastern Connecticut that are experiencing similar levels of case counts relative to their respective populations.
So what is the positivity rate of the region right now? Is that a better number for people to go by or not?
You can look at it in any number of different ways. I mean, I think for those 11, as an example, for those 11 municipalities, 9 of which are in the southeast part of the state there, collectively their positivity rate is about 3%. So it's certainly much higher than the rest of the state, as you would expect. So we look at it both ways.
Okay, thank you. And Governor, right now, states across the country are allowing early voting. In Connecticut, I think is like one of 5 that doesn't allow it. Would it have been helpful if we had early voting here in Connecticut during the pandemic?
Well, I'd like to think the absentee ballot process is facilitating that. And I know we've had tens of thousands of people who have submitted their ballots already. As you probably know, we've greatly expanded the capacity at all of our local town halls so they can start processing the ballots sooner, so they can start counting the ballots on Election Day. Anybody who has an absentee can drop it at one of hundreds of electoral drop boxes around the state. So hopefully we'll be able to answer that question.
Okay, thank you very much.
The Connecticut Mirror.
To start, I just wanted to clarify something. So in the 11 alert communities, so far they have not taken any action in response to this as far as rolling back to phase 2 or changing school instruction. Is that correct?
Well, first of all, on the rolling back to phase 2, we just got the executive order out, I don't know, yesterday or something. So they are going to give us 3 or 4 days they've got to make up their mind. My understanding is Norwich has gone all remote. Do you know about any of the other red towns?
Yeah, well, so, obviously of the 4 that were in the red category last week, so there's another 7 added. They're just added to the list today. So they'll obviously have to start deliberations about whether or not they want to go in that direction. As the governor said, under the new executive order, they'll have until Monday to make that decision, which would then be effective, a couple of days after that. So we'll await their guidance.
Has the contact tracing giving you any indication as to causes of these outbreaks, or at least this increase in cases? Commissioner Giffen?
Yes. What the contact tracing shows, and it really does tie in with some of the recommendations on our alert level map, is that the same thing that the governor and I have been saying for the past couple of weeks, which is that the transmission we're seeing is happening in among friends and family and coworkers. And whether that's in a social setting at the workplace or a social setting before or after work, or if it's happening on the weekends with friends and family and people letting their guard down a bit on the mask wearing, that's where we are seeing the transmission. It's in settings that people might consider to be benign because they're small and they're with people that they know. And unfortunately, that is across the country, as Dr. Birx indicated when she was here last week, that is the type of transmission that we're seeing. This virus is extremely contagious, and it's very easy to catch it. So if you're in an indoor setting with somebody who's not part of your household bubble, you can catch the virus from them even if they have no symptoms. So the work that's before us, and for these the residents and officials in these alert towns, is to re-emphasize the importance of keeping your contacts with people outside of your family that you live with, keeping those contacts minimal. And if you're sick or if you have been exposed, you do need to stay home for the 14 days. And that's the way to break the cycle. The contact tracing does show occasionally, a sports team, for example, where we're maybe seeing some cases transmitted, or a workplace. But in general, the local health departments are telling us that what they're seeing predominantly is this kind of spread within friends and family.
The Connecticut Convention and Sports Bureau announced a little while ago that 5 college tournaments, championship tournaments, are coming to Connecticut in various sports. So how does that fit in with Connecticut's current status and any concerns that you all have for how these should be run?
I think we got to take a look at that, Paz. I can just reiterate or amplify on what Deirdre was saying. I've talked to some of my neighboring governors, and you're right. Sports has been a track and trace source of a fair number of infections. not so much on the field, not so much on the rink, not so much on the court, but all the team events, taking the sharing a car, 8 of them there, being in a motel, 5 in a room, being at the buffet table. That's where we've seen a fair number of flare-ups, some in this state and a lot in some other states. So we are watching this very carefully.
Yeah, and I'll also add as well, as you probably know, Paz, and everyone on the line, the earliest championship that's going to be represented that was announced would be in 2022, with 2022 and 2023, 24, and 25 for those various sports. We're going to have a lot more information about where our state stands when it comes to COVID by that time. And as the governor stated and DPH has always previously stated, anything that will be done will have to be done with the overall guidance of the state of Connecticut and the Department of Public Health.
And thank you. I actually read right past the years on that, so I apologize for that. I'm all set. Thank you.
Connecticut Public Media. Hearst, Connecticut Media.
Thanks, Max. Hi, Governor. This morning, the Connecticut Business Coalition asked for $70 million. You're offering 50. Is this something that can be negotiable in aiding towns aiding companies along the line?
Look, I've got every entity in the state is coming up, and they're all in need, and we're doing the best analysis we can in terms of what the real needs are, how we can satisfy it with our limited, CRF funding. So I think they understand. Nobody more than small business people understand our need to live within our means.
Thanks, and also the State Department of Education, I guess today said it's going to push the state tests back to the spring. Is that a good idea for you? Or have you been consulted on that?
I wasn't consulted on it, but it makes a lot of sense to me.
Okay, thanks. Thanks, Max.
The Waterbury Republican American.
Yeah, I got a question on the advisory committee. Why is it meeting for the first time before the initial report is being submitted to the CDC? Wouldn't it make more sense to have these group of experts and stakeholders to offer their input before you submit a plan?
Right. They are going to be offering their input tonight before the plan is submitted. Granted, only one day before the plan is submitted, and that's sort of the deadline that we have. But I want to emphasize again what the governor said. This is an initial draft plan. We'll submit it tomorrow to CDC, and then we'll immediately begin revising and reiterating. There's so many unknowns right now in the vaccine strategy, not the least of which is when we will have one and what it will look like. So this vaccine plan, by its nature, is preliminary, and we very much look forward to the input of our advisory group and the 3 subcommittees on subsequent iterations of the plan.
Okay. And looking at this new color-coded map and the numbers that are in the report, when you look at the 14 communities that are in the 10 to 15% range, you have a number of them that are really bumping up against that 15 per 100,000 threshold. Why is that?
It's because COVID is a very contagious disease, and it is spreading right now in Connecticut. So I'm glad you brought that up, because that is the purpose of this new alert level map, is to make sure that every person in Connecticut can look at that map and know where their town is on the yellow, orange, or red alert level, and take the actions that we're recommending, particularly if you're an older individual or you have a high-risk condition. It's good to know where your town is on this alert level and limit your activities accordingly. until such time as things turn around in your area and get back below the yellow level.
Okay. And Governor, getting back to the travel ban, are you saying travel ban? Excuse me, the travel quarantine. Are you saying that it should apply to basically people from any state that travel to Connecticut? You know, figure on quarantine here for 14 days unless you've got a negative test 72 hours prior to your arrival here, or you get tested here and come up negative before the quarantine period is up?
We're thinking about that, Paul, exactly. Now that you got 36, 39 states, it's probably a lot simpler and clearer. If you want to come to Connecticut, this is what you got to do, test and quarantine.
Will you be doing that in conjunction with New Jersey and New York, or is this something that the state will do unilaterally?
No, we like to work in conjunction, so Deirdre and Paul are talking to our neighboring states.
And in terms of the grant program, I know you said that you were going to be announcing the details next week. Can you give the small business and nonprofit community an idea of when they'll actually be able to apply for this funding?
I think within a week.
Within a week. And the source of this funding, is it what is it? Is it state bond funding? Is it federal coronavirus relief funds?
Bingo.
A combination.
It's our CRF funding.
Oh.
We're allocating a little more to small business and not-for-profits.
Okay. And when might the, I think the larger event venue you mentioned, you said at some point later, will that be?
The performing arts centers and the such, David's going to be rolling out a relief plan, I think, over the next 4 or 5 days.
Okay. Thank you.
Thank you.
The Hartford Current.
Hey everyone, this is Emily Brinley from The Current. Governor, just to clarify what you're saying there about the travel advisory, so you're saying that you are still working in conjunction with New Jersey and New York to talk about any potential changes to the advisory?
Yeah, it just makes a lot more sense to me if we can do this as one. New York and New Jersey are both creeping up towards that quarantine level themselves. And I'm trying to simplify this, make it easier for travelers so they know what the, quote, rules of the road are. So we ought to have some clarity on that within a few days, a week.
Okay, thank you. And Dr. Gifford, I also wanted to ask about the Vaccine Advisory Group's meeting tonight. Will the members be given a copy of the draft plan that the Department of Public Health is going to be submitting to the CDC, or are they going to be talking about it in more vague terms?
We will give the advisory members the plan when it's done, and it will be posted on our website so members of the public also can see it. We're still, as you might imagine, we're still editing and finalizing the draft, but as soon as it's ready for public viewing, we'll share it.
So that means that for tonight's meeting, when the members are discussing the draft of the plan, they won't actually be looking at a copy of the draft?
No, they won't. We're going to sort of present an outline of the main content areas and ask them for content and feedback. But again, I will just reiterate, this is an initial draft plan. It'll get submitted tomorrow, and as soon as it's submitted, we'll start editing it again. So there is nothing permanent, carved in stone or otherwise. And we should all be viewing it with that lens.
Thank you.
CT News Junkie.
Thanks, Max. Hi, everybody. Dr. Gifford, has the Public Health Department been involved with consulting with the CIAC on the winter sports schedule? We were just talking about the one that was just released.
So we will be. We have been, I think they've reached out to us, and we're going to be setting up some time to discuss winter sports with them.
So you haven't discussed it yet. Would the department be recommending that they keep to the schedule based on everything we know is going on?
I think we'll decline to speculate on what we might be recommending, although I think we've been pretty clear in our prior recommendations that high-risk sports ought to wait. So we'll continue to talk to them about the schedule, about the particular sports, importantly about any mitigation strategies that have been developed or we've seen implemented elsewhere that might be successful. But given where we are with our spike in numbers, what the governor alluded to, what we're seeing around sports, both locally and around the country, we'll want to take a cautious approach to sports as we did in the fall.
Okay. Some folks are asking how wrestling ended up approved, or football was not approved. Do you see numbers increasing in that area at all?
I'm not sure what you're talking about with wrestling. That was on the list of high-risk activities that the department recommended postponing. Yeah.
Apologies. Governor, could you talk a little more about the grant program you mentioned for businesses? I think you said something like $50 million between 1 and 20 employees. How much money would we be talking for individual businesses?
Say $5,000. So this would be widely dispersed to maybe 10,000 different small companies, half of that going to folks in distressed municipalities, helping those small companies with some of the major rent, electricity, some of the infrastructure they got to keep going so that they're stronger once we're on the backside of this pandemic.
Okay. One last thing. You mentioned Wisconsin earlier. This past week, a judge there struck down or blocked an effort by the governor there to sort of limit or place limits on the bars, the capacity of bars and restaurants and that kind of thing. I was wondering if you had any reaction to that and what has to happen here in Connecticut before you would consider opening bars and nightclubs again.
Every governor I've talked to, even those from the reddest of states, have said opening the bars while infection is on the rise was a big mistake. And I hope the courts realize that would be a big mistake if they forced us to open there. We're also getting sued because some people don't think they have to wear masks inside and as such. They think that's obtrusive. And again, you talk to everybody from the federal government to different state governments. Increasingly, we realize how important wearing that mask is. It's really been important in keeping our kids safe in school.
Okay, thank you.
All right, Max has given me the signal. Thanks, you guys. I just wanted to say on a personal note, we're talking about the COVID virus, how incredibly infectious it is. I haven't said this in a few months, but racism is also incredibly infectious. And I just think we got to speak out every time that you see it and hear it. And I think you should do that if it's an informal company. I should do that as governor. I cannot believe what was going on online, the attacks on Johanna Hayes, of a racial nature, just not Connecticut, not right. And I can tell you, Rosa DeLauro's been hit as well in terms of some ethnic cartooning and caricaturing, which is just wrong. And there's been a Shiva, like a Jewish wake, where again there was a number of racial epithets thrown. And come on, Connecticut. I know there's a lot of edge and hostility out there in the social media, but I hope when you see it, stand up and say, not in our state. Thank you, everybody.